Hi, this is Don. I recorded a previous video about the same subject matter of choosing alternative health options when you have an illness that is not responding to traditional medical care. And I got a little long-winded and got cut off in mid-sentence. So I want to kind of finish that up, but for those of you who didn't see it, I'll do a brief summary and should cover everything. If you want more detail, you can go back and look at that. Someone had saved it, so I didn't want to delete it. Maybe I'll do it over again at some point. Anyhow, I've been suffering with fairly significant food sensitivity for 3 years. Traditional medical care couldn't assist me, so I tried alternative health care. And I discovered there are literally thousands of people around the world who have similar ailments that do not seem to respond to regular medical care, and so they're looking for alternatives. But it can get overwhelming when you get into the field of alternative medicine. What are you going to choose? What might be effective for you? So I thought I could share my experiences that I wish I had known when I was starting out, that would have saved me time and been a big help. Hopefully, if you're going through something like this, or you know someone who is, probably all of us know somebody who's got some sort of digestive problem or some sort of sensitivity they have, or long COVID, a variety of things. And they're all kind of related in a way, but there are some treatments available. Now, when you go the alternative route, the first line of approach that you might want to try are what's called functional medicine or integrated medicine. And these are often people with medical backgrounds who get additional training and treat you as an entirety. They don't specialize in one part of the body, but they look at the whole system. They use non-invasive treatments. A lot of them will use supplements of various sorts, herbal medicine, homeopathic medicine, stress techniques and the like. And often you might find someone who's a good fit for you. If I have one overarching message, it's, first of all, don't give up. Just because it can get discouraging, but don't give up. It's a matter of finding a match. Each of us is unique psychologically and physically, and you have to find an approach that works for you. It may not work for everyone else, and that's what I did. It took me a good while. Finally, I found someone who was a good fit for me, and after 3 years of bouncing around, he basically turned my situation around in about 3 weeks. So I want to tell you a little bit about that approach and some others. After I tried some of the functional medicine approaches without really having much success, I tried hypnotherapy and never had been hypnotized in my life. A fascinating experience, deeply relaxing, didn't really turn the condition, the food sensitivities around, but was still valuable. And what I found is everything I tried, even if it didn't work, I think contributed to the ultimate success. So don't get discouraged if you try something and it's not a complete success. It may help you down the road. Ultimately, what was of help was something called healing medicine. And I tried some activities and read about it on my own and found my body was responding to it. I thought, gee, if only I could find someone who was specialized in it. And fortune smiled on me, and I met someone, and they were an energy healer. And they began to work with me. So you might wonder, what's energy healing? What's that about? And it's actually an age-old practice. There's been various forms of it for hundreds of years, but the basic notion is that just as our body has blood vessels, a blood system, and a nervous system, that we also have pathways and centers for our energy as well, and they can get blocked. Problems can occur, and so various healing approaches work with those channels, and acupuncture is probably the best known. Acupressure, Reiki massage, and the like. This practitioner used an approach I'd never heard of before. It's called Natural Bioenergetics. The headquarters is in Canada. They have an organization in England, and there are many practitioners in the United States. What's nice about them, though, is they can work from a distance. So even if you don't have one locally, they can still work with you. Now, I'm going to try and describe from my perspective how they work. you'd have to listen to them to really understand. To be honest with you, it almost seemed mystical. I thought, this can't work, but my healer had a science background. He was a research scientist by training, a PhD in biology. He published in scientific journals. He taught anatomy and physiology. So he had a strong background, and he assured me there's nothing magical about what he's doing. It's all based on skills that anyone can learn. And boy, it got some very significant results. The basic concept, and I'm putting it in my words in terms of my experience, is that, we think of our bodies as sort of running on autopilot. And we have our minds, but most of our physical functions occur automatically. We don't have to think, I need to get my heart beating or my stomach digesting or whatever. These happen automatically. I think it's called the autonomic nervous system is in charge. But my sense was that there is a bodily intelligence. There is some sort of intelligence or awareness that's coordinating all this and can determine what's wrong and, in some cases, how to fix it, but it often needs some help. And so this approach essentially communicates with your body, that kind of awareness and intelligence. And it does through a system called muscle testing, which gives yes and no answers. Chiropractors sometimes use that. It's fascinating and very, very, very powerful, and you can learn to use it on yourself. You can learn some basic skills, and I've learned that. And maybe in another video I'll talk about how to do that in case you're interested. So, he worked at both a physical and psychological level, and he takes his energy system and is able to link with yours. And that allows him to scan you physically to see what's going on wrong and to actually intervene and make changes. It's totally non-invasive. He doesn't use medication or anything. It's his link with you. And I know that sounds almost supernatural, but having experienced, I think there's really something to it and extremely powerful. If anybody has any questions about this approach or any of the others that I talked about, feel free to ask them in the comments section or message me. I'd be glad to give you more specifics in terms of natural bioenergetics or some of the other approaches. But once again, don't give up and realize it's a matter of finding a fit. And one of the things I did was, someone would say, I had a digestive problem for many years and I did this and it cured me. And then I would try it and it didn't have that effect. So, different things work for different people. Okay, so I wish you well if you're dealing with an illness. Don't give up. I believe there is an answer. And if I can be of any help, let me know. Take care.